Hello everyone and welcome to a new session of Dr. Khaled Hasan YouTube channel. I am Dr. Khaled Hasan, Professor of Clinical Pharmacology, Drug Therapy and Clinical Research. Today we are going to address important issue in the academia and the healthcare system, and this one about how to study pharmacology and clinical pharmacology. Okay, as you can see here, we have studying pharmacology rely on the five-step methods, and we are going to discuss this methods with you from 1 to 5 methods, and if we have any extra points we can speak about later on. So I use these methods in the classroom to ace the student achievement in pharmacology class. We all aware that studying pharmacology considered like stress, and student maybe suffer from the memorizing long list of drug names, and also we have massive textbook. We have several large textbooks such as the Bureau Pharmacotherapy, we have Goodman-Gilman Clinical Pharmacology, we have Katzong Pharmacology, we have Lippincott Pharmacology. So we have so many textbooks, and we are maybe overwhelmed with this large information, and this textbook available on the website or like PDF or physical copy. Okay, so feeling overwhelmed by pharmacology, that means you are not alone. In this video, I break down the 5 most effective study strategy that will help you stop memorizing and start understanding. We will cover how to learn drug classes fast and the right way to use flashcard, and number 1 mistake most students make. Again, as we mentioned in the beginning, we ask you a question: is your pharmacology class making you feel completely overwhelmed? Are you staring at a list of hundreds of drugs, wondering how you are going to remember them for all your next exam? So if that's you, I want you to take deep breath. You are in the right place. In this video, I'm going to share the exact 5-step methods that will help you conquer pharmacology without losing your mind. So most students make one huge mistake when they start this course. They treat it like like a giant memorization game. They try to cram every single drug name, the side effect, the mechanism of action into their brain a few nights before the exam. However, pharmacology is not about memorization. Again, pharmacology is not about memorization. Pharmacology about organization. It's about learning the patterns. Once you see the patterns, everything click into the place. So let's go into the 5-step will help you do just that. Okay, let us start with the first step. The first step will be learn the suffix, not the drug. This is absolutely biggest game changer. Stop trying memorizing. Stop trying memorizing, for example, propranolol, atenolol, and metoprolol as 3 separate drugs. Instead, focus on these drugs as maybe they have something in common. They all end with the OLOL, lol. So the situation here, we try to maybe memorize and remember the. Okay, so as you can see here in this slide, we try to remember the suffix. So when you have any medication end with OLOL, such as propranolol or atenolol or metoprolol, we need to link this to the group of medication called beta blocker. We have another suffix, and I'm going to bring like a list of medication with the similar suffix. We have Brill, we have statin, we have Celine. So we're going to speak about them one by one. Okay, again, as we mentioned here, learn the suffix, not the drug. We have metoprolol, atenolol, propranolol. All these belong to the beta blocker. Then we have another suffix that help us to maybe remember, understand, apply the information. Okay, so the first table here, popular drug suffix and their classes. We have OLOL that indicate to the beta blocker class here. We have metoprolol, atenolol, and propranolol, and so on. We have a group of medication. I refer you to the beta blocker YouTube. Then we have the Brill, belong to the ACE inhibitor. We have example of the ACE inhibitor. As you can see, lisinopril, we have Brill, enalapril, remapril. So we have a group of medication ended with the Brill, and this maybe help us to understand and remember this medication belong to the ACE inhibitor. Then another suffix, we have sartan, and when we have medication ended up with the sartan, we link this medication to the angiotensin 2 receptor blocker. We have losartan, then we have valsartan, albisartan, telmisartan, and a group of sartan, and this is considered like ARBs inhibitor, angiotensin receptor blocker. Another one for suffix, dibine. This is belong to the calcium CCBs, calcium channel blocker. Here we talk about amlodipine, nifadipine, phenoldipan, so or philodipine. So we have a group of medication here. Next we have statin. A statin like HMG-CoA reductase inhibitor. This medication, group of medication as the atorvastatin, simvastatin, rosuvastatin, medication used for hyperlipidemia or dyslipidemia. Speaking about brazol as a suffix, this group of medication belong to the proton pump inhibitor, and example of these medication ended with the brazol. We have omeprazole, pantoprazole, esomeprazole. So you can see the suffix brazol. We link this one to the group medication called proton pump inhibitor, PPIs. A group of medication ended with the tidine. We have belong to the H2 receptor antagonist. Here we need to remember H2 stands for histamine receptor. And when you have ranitidine, famotidine, cimetidine, this group of medication, black histamine receptor, black H2 histamine receptor. Okay, next, as you can see, we have triptan, and this is speaking about serotonin receptor agonist, and this is a group of medication used for headache and migraine. We have somatriptan, rizatriptan, zolmitriptan. And this slide here, you can see here we have class number 1, popular drug suffix for class number 1. Then we can move to another group of medication. As you can see here, we have another class of medication. We have monoamino oxidase. We have monoclonal antibody, monoclonal antibody. This is a medication ended with a MAB, monoclonal antibody. As we can see here, we have adalimumab, infliximab, trastuzumab. This medication belongs to the monoclonal antibody. Then we have NEB. This belongs to the tyrosine kinase inhibitor, and you can see the suffix imatinib, erlotinib, sorafenib. So this medication belongs to the tyrosine kinase inhibitor. Cane, and this is normally indicated local anesthetic. So as you can see here, we have lidocaine, bupivacaine, brocaine. So when you have lidocaine, remember this is local anesthetic. Lidocaine, bupivacaine, brocaine, cocaine, and so on. Then we have cycline. Cycline, we have tetracycline antibiotic, we have doxycycline, monocycline, tetracycline, and so on. Antibiotic, and this is one of the best medication for acne, for example, or for the cholera or for Lyme disease, tetracycline. Moving to the next group of medication with the suffix fluoxacin. Fluoxacin or fluoxacin, this belong to the fluoroquinolones antibiotic. So we have ciprofloxacin, levofloxacin, and then we have moxifloxacin. And this group of belong to the antibiotic that inhibit DNA gyrase enzyme. Okay. Moving to the mycin, when you have mycin, macrolide or aminoglycoside antibiotic. Example, we have gentamicin. Another example, we have azithromycin. Gentamicin belong to the aminoglycoside, and azithromycin belong to the macrolide. Iver belong to the antiviral drugs. Example, we have oseltamivir, and then we have zanamivir. Saline is the medication, is the suffix saline or saline. We have penicillin, we have amoxicillin, we have ampicillin, we have decloxacillin, and the group of medication belong to the under the umbrella of penicillin antibiotic. Okay, the second tip regarding how to learn pharmacology, how to study for pharmacology, the second tip will be master the flashcard methods. We heard from everyone saying that use flashcard, but how we can use them? Is the matter is how to use a flashcard. Don't only just write a drug name on the front of the card, then in the back of the card you can write a list of information, a wall of text there. So there's a maybe system to write the flashcards. Very important for everyone to follow. Here the example for the front, maybe the front page of the flashcard. As you can see here, we have a good example, we have bad example. So for bad example, don't write everything on the front page of your card, flashcard. Okay, you can see here, for example, ramipril or ramipril. We can type only like a bullet, like ACE belong to the ACE inhibitor, and this medication used for hypertension, for example. We can add here heart failure treatment. Okay, another example here, as you can see for metformin, we don't write everything about metformin. Okay, we move to the writing only bullets about the takeaway point. Metformin belong to the big one-eyed group used for type 2, the treatment of type 2 diabetes. So on the back of your card, we need to break it down into 4 sample categories. So as you can see here in the back of the card, we don't like to type a lot of information there. We need only like simple 4 category. We need to mention, for example, drug name and drug group or drug class. Then we move to the mechanism of action, key side effect or adverse effect. I recommend adverse effect more than side effect. Then consideration there. So we go the consideration. Okay, so any side effect like or contraindication, warning, precaution. Here is an example for ramipril as a drug class, category. Ramipril belong to the ACE inhibitor, angiotensin converting enzyme. How this medication work? We need to explain it simply. Ramipril inhibit angiotensin converting enzyme, as you can see it here. And the key side effect will be, or the important one, or could be the most dangerous one, or like life-threatening, dry cough. Then we have angioedema. Then we have hypotension. Consideration, this group of medication, ACE inhibitor, considered like phytotoxic, and therefore it's like considered like contraindicated during pregnancy. Okay, moving to the third tip. Third tip will be become mnemonic maniac. Okay, regarding mnemonic maniac here. The first tip and the second tip. The first tip is talking about the suffix. The second tip talking about the flashcard. What happened with the medication? We don't have suffix, for example. How we can manage that? So if we have a drug do not have like a suffix, this is where you get your creative here, or using mnemonics. For example, you can create your mnemonics, or you can maybe Google it and look what we have in the other website about the medication. And I'm going to bring some example for the mnemonic maniac. So as you can see here from this PowerPoint, we have one heart, therefore we have beta 1 receptor. So we have one heart, we have beta 1. However, we have two lungs, as you can see it here, we have two lungs, and therefore we have beta 2 receptor. So in the heart, we have beta 1 because we have one heart. In the respiratory system, in the lung, we have two lungs, therefore we have beta 2 receptor in the heart. So what type of beta we have in the heart? We have beta 1 because we have one heart. What type of receptor do you have in the lung respiratory system? We have beta 2 because we have two lungs there. Okay, we have another mnemonic. This another mnemonic called double quarter pounder, and this is a mnemonic for the antiarrhythmic drugs. As you can see from this table here, this table belongs to the antiarrhythmic drugs that I have it on the YouTube. As you can see here, we have a category for antiarrhythmic drugs. We have class 1, class 2, 3, 4, and we have other. Uh, as you can see, class 1, we have subtype. We have class 1A, 1B, 1C, and all the class 1, as you can see, it's here, black sodium channel. We have intermediate, weak, and then we have strong. However, we need to remember the medication name. Class 1A, we have 3 medication. Class 1B, we have 2 medication. Class 1C, we have 2 medication. So the total will be 7 drugs in the class 1 antiarrhythmic drugs. Class 1A, we have the disopyramide, quinidine, then we have crocanamide. Class 1B, we have lidocaine, mexiletine. Class 1C, we have flecainide and propafenone. How we can remember that? The mnemonic, as you can see here, the mnemonic to remember that, we have double quarter pounder with lettuce and mayo, fries please. So I will, if you look on the first letter for this word there, double quarter, double stand for disopyramide, quarter for quinidine, pounder for procainamide, lettuce and mayo stand for lidocaine and mexiletine, fries please stand for the flecainide and propafenone. So in this case, make the situation easier for me. For example, if someone asks me, okay, can you tell me about class 1 A antiarrhythmic drugs? So double quarter pounder, disopyramide, quinidine, procainamide. What about class 1B? We have lettuce and mayo. We have lidocaine, mexiletine. What about class 1C? We have fries please, flecainide and propafenone. Okay, in the next coming slide, I'm going to maybe discuss the popular and classroom loved pharmacology mnemonic. We have some popular mnemonic in pharmacology. I'm going to present it here for the discussion. As you can see here, we have, for example, we have dumbbell for the muscarinic effect, like cholinergic toxicity, dumbbells. As you can see, D for diarrhea, U for urination, M for meiosis, BB for bradycardia and bronchospasm, E for excitation, and then we have L for lacrimation, SS sweating and salivation. So as you can see here for dumbbells, here is someone suffer from toxicity from cholinergic agent or like muscarinic agent. This will be the, you can see a list of side effect, and it's not easy to remember these side effect. But when you someone ask about the cholinergic toxicity side effect, we can remember dumbbells. Diarrhea, urination, meiosis, bradycardia, bronchospasm, excitation, and so on. Another one is important for us here. We have opioid. Opioid belong to the narcotics. Here we have the mnemonic morphine. We talk about the effects of opioid on a human body. So as you can see here, we have meiosis, which means narrowing the pupil of the eye, meiosis. Orthostatic hypotension, which means dropping blood pressure. Hypotension when you change your position from supine to the standing or sitting. The medication opioid cause respiratory suppression, and you can see here R for respiratory suppression, B for pain suppression, H for histamine release. Then we have I for the increased intracranial pressure, ICP. Then we have E, N and E for nausea and emesis. Emesis mean vomiting. The last one here on the list, we have tricyclic antidepressant. This is a medication belong to the antidepressant medication. As a side effect, patient may suffer from convulsions or coma or cardiotoxicity. Okay, moving to the tip number 4, as you can see here, the best way and is highly recommended to teach what you learn in the classroom to your classmate, to the family, or use your whiteboard, writing down. This is maybe engage your tactile, your sensation, your touch sensation. Okay, the fastest way to find out if you truly understand something, try to explain it simply. maybe get a friend, family member, or even just use a whiteboard to explain to yourself and try to teach the concept out loudly. Speak it loudly. So, for example, you can say, okay, we have propranolol here, and propranolol bind to the beta receptor, blocking beta receptor and decrease heart rate. So you can explain it to yourself, or to the member, to the family, to the classmate. So explain it to someone. Write it down, explain the material to someone, teach the material to someone. Tip number 5, highly recommended to maybe to utilize a drug guide like a bucket drug guide, and we are going to speak about that in the next slide. So as we all know that the pharmacology textbook is great for the in-depth information. If you like to understand the material in details, go to your textbook. But the textbook is large and overwhelmed, therefore we recommend you to use some other resources such as Bucket Drug Guide. Think of it as your pharmacology dictionary. As you can see here, you can see the large textbook, and then we have drug guide, drug bucket guide. Okay, as a recap and summary of our session, how to study pharmacology, how to learn pharmacology, we address 5 steps. Number 1, focus on suffix to learn the entire drug classes at once. We remember we have Cellin, we have OL, then we have Brill, we have Sartan, we have Statin. This is number 1. Number 2, create flashcard. Don't type a huge amount of information in the flashcard. The front page, type the drug name, drug group, and uses. Maybe the front page, and the back of the card, try to type only 4 category there with a summary. Number 3, try to create mnemonic. If you remember, we have morphine for opioid, we have dumbbell for the cholinergic. And number 4, it's recommended to teach this information to someone else, like classmate, friends, family. And lastly, try to use a drug guide textbook or like bucket drug guide, and that will help you to learn the material quickly as a reference tool. Okay, this will conclude our session about how to study and learn pharmacology. I hope this will help everyone, every student who prepare for the exam, who is willing to learn pharmacology and apply pharmacology in everyday activity and everyday practice. As we mentioned, pharmacology and drug therapy formulate 25% of the practice, because when you see the patient, you diagnose the patient, you implement a clinical exam, then at the end you are going to prescribe a treatment to the patient. So treatment, drug therapy, pharmacology is like very important, like 25% of your healthcare practice, and it's very important to learn all these material related to the pharmacology. Thank you so much for your time, and enjoy the rest of the day.